It may be time to drop the masks. Today, the CDC announced that most Americans live in places where healthy people can safely go without wearing masks indoors. New measures will help guide communities to roll back restrictions where COVID cases are declining. The guidelines focus more on what's happening at hospitals and less on positive test results. Right now, more than 70% of the U.S. population live in counties where the virus is posing low to medium threats to hospitals. Those people, the CDC says, can stop wearing masks. The agency says that people, including school-aged children, should wear masks where the risk of COVID is high. So what does this move mean for where we are in the fight against the virus? To answer our questions, we welcome Dr. Ashish Jha. Dr. Jha is the Dean of the Brown University School of Public Health. Thank you so much for joining us. Dr. Jha, why should we feel confident not wearing masks indoors while a highly contagious variant like Omicron still exists?
Yeah, so first of all, thanks for having me back. I think it's a really good question. The big point of this new CDC guidance is that we're in a different place than we were 2 years ago, that most Americans are either vaccinated or have been previously infected. Particularly people who are vaccinated and boosted have a very, very high degree of protection against severe illness. And I think that should give people confidence of being able to be indoors, especially when infection numbers are not particularly high in their community.
It may be difficult for some transitioning to the no mask, especially after wearing one for so long. Dr. Jha, what can people do to protect themselves as we enter this next phase of the pandemic?
Yeah, so the single biggest thing, and we have learned this really clearly, the single biggest thing people need to do is get vaccinated and get that booster. Booster is really, really important with Omicron. The other thing I would say is, obviously we're at a point where it's going to take a little time for people to get comfortable taking off that mask. I think people are going to adjust to this slowly, but I do think it's reasonable as infection numbers continue to decline for us to be able to get rid of those mitigation requirements.
Dr. Jha, we know that the number of Americans hospitalized with COVID has plunged by more than 100,000 since Omicron's peak and is projected to keep falling. Why use hospitalization capacity as such a crucial benchmark in our communities?
Yeah, there are two good reasons, I think. One is, of course, we care about severe disease. That's what we want to avoid. And so hospitalizations for COVID, obviously a critical measure of how people are doing. The second is, hospitals have a lot of other roles to play beyond taking care of people with COVID, heart disease, strokes, appendicitis, car accidents. We want to make sure that hospital capacity is in good shape to take care of all of people's needs. And that's the other reason why hospital capacity is such an important measure in the new CDC guidance.
Okay, so let's talk about the COVID vaccine. The rate of Americans going to get their first COVID vaccine has plummeted to a record low. There are still more than 59 million eligible Americans that are completely unvaccinated. Tens of millions more are not boosted. Is this concerning to you? How does this impact the fight against COVID?
Yeah, it is concerning for a couple of reasons, Stephanie. I mean, one is those people remain vulnerable to having an infection and getting really sick from that infection. So I think it's critically important that people get vaccinated and boosted. And what we saw in the Omicron surge is that when hospitals got stretched to their limit or beyond, it was almost all people who were unvaccinated or certainly people who were not boosted. So for the broader society and our healthcare system, really critical that people get that shot.
And there's been so much talk about a second dose, a third booster. The CEO of Moderna said this week that Americans will likely need a second COVID booster shot and then yearly boosters after that. What do you think about the FDA possibly combining the next booster dose with the flu vaccine in the fall?
Yeah, so this is actually a really interesting idea. I mean, the way I look at it is I get a flu shot every year. It's a requirement for me to work in my hospital. If we end up needing a COVID shot once a year, I don't think, first of all, that's a huge burden. And second, if that's a good way to keep people safe, and if we can make it more convenient by combining it with the flu shot, I think that'd be a great idea. So that may be a part of the way we manage this over the medium to long run.
Just recently, the former FDA vaccine chief said it was too early to tell if that 2-in-1 would be needed. We shall see. But Dr. Jha, we are more than 2 years into the pandemic. Do we need to just accept that this virus will never go away?
Yeah, so the virus is not going to go away, I don't think, anytime soon. The good news is we know how to live with it. If people get vaccinated and boosted, if we wear masks during surge times, we can avoid mitigation during most other times. If we use testing, more therapeutics, this can become just something we manage on an ongoing basis without it really having a profound effect on our lives.
And here's a topic that a lot of parents are talking about. There's still a large part of this population still not eligible to get vaccinated, kids under the age of 5. In your opinion, will that change anytime soon?
Yeah, again, we'll have to always be driven by data and evidence on this. One of the things that's been reassuring about getting kids 5 to 17 vaccinated is the evidence behind it is so good. We want the same level of evidence for kids under 5. I'm hopeful that in the next month or so, we're going to see that evidence with ongoing clinical trials. And if we have it, that'll be great, because that means really the last group of Americans, people under 5, kids under 5, will finally be able to get that shot.
Dr. Jha, always nice to have you. Thanks for sharing your expertise with us. We appreciate it.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.